Hello. Oh, isn't it nice and wet today? Okay, good to go. Okay, well, good morning, Queensland. A rather wet morning today. I'll start with the COVID update. We've had 5,440 new cases reported in the last 24 hours. 3,110 of those are rapid antigen test results and 9,628 tests. Sadly, we've had reported 7 deaths in the last 24 hours, and I'll have the Chief Health Officer talk through all of our other COVID numbers today, other than I'd like to say it's pleasing to see that the number of children testing positive is starting to come down, and for the second day in a row we're seeing those numbers lower, which is a good sign. I also wanted to give, before I hand over to the Chief Health Officer, an update on the weather. We have Deputy Commissioner Steve Golczewski here from Queensland Police Service, and I also have Deputy Commissioner Mark Roach from QFES here. We have obviously seen some very heavy rainfall this morning and overnight, between 150 and 200 mils in the Sunshine Coast hinterland around Pomona and Moy Pocket, between 200 and 300 mils in a 6-hour period in Bundaberg, and 448 mils near Biggenden, including 160 mils in 1-hour period. Because of the heavy rainfalls we're having, a lot of catchments are very saturated. We're expecting more heavy rain throughout the day, and flash flooding remains a risk. So if you need assistance, call SES, call 132 500, and in an emergency, of course, 000. Please listen to the media updates and listen to warnings. It's so important to remember, if it is flooded, forget it. It is not worth risking your life, and sadly we've had 2 loss of life already. We don't want to see any more. Please keep your children out of floodwater, and please do not drive through floodwaters. SES received more than 120 requests for assistance, mostly in the Sunshine Coast and the Moreton Bay Regional Council area in the past 24 hours. And swift water rescue crews have responded to almost 40 rescue incidents since Wednesday afternoon. So please make sure that you are staying out of the waters. That means that our frontline emergency services get to concentrate on where they need to be. And also we just want to make sure everyone is staying safe. So please keep an eye on those weather updates, both in the media and on social media. I'll now hand over to the Chief Health Officer, and then we'll hear from Deputy Commissioner Roach.
Thank you very much, Minister. Today, sadly, we have 7 deaths to report from COVID-19. 3 people in their 60s, 3 in their 80s, and 3 in their 90s. Of these, 3 were not vaccinated, 3 had received 2 doses of vaccine, and only 1 had received a booster. Of the 7 involved, 6 were from residential aged care facilities. Thoughts and sympathies with their families today. Today actually marks a month since our peak hospitalisations. On January 25th, Queensland had 928 people with COVID-19 in hospital, including 51 in intensive care. Today there are just 333 in our public hospitals, 27 of whom are in intensive care. This is just a reminder of how much can change in just 1 month. In the private hospitals, there are 17 patients with COVID-19, the same as yesterday. That includes 3 in intensive care. In our school-aged children, between the ages of 5 and 17, there has been a decrease in the number of reports in the last 24 hours to 1,396. That's down from 1,924 yesterday. These numbers will fluctuate daily, but the main thing is we are not seeing a substantial surge in school-aged children. Now, we are expecting ongoing transmission of this virus in the coming months, heading into winter, and we are watching carefully New South Wales and Victoria as they lift their mask mandates today. As Queenslanders will be aware, we are going to be lifting the indoor mask mandates for most situations from next Friday. We will, however, be monitoring any effect of changes in the mask mandates, both interstate and in Queensland, in the coming weeks, and if necessary. If situation does change, it may well be that those mandates do need to be implemented again. That's always been something that's on the cards. But at this stage, the situation is under control. I would also encourage people, if from next Friday, when we do lift those mask mandates, to continue to carry a mask with them when we do lift those mask mandates next week, and particularly in crowded environments where you can't social distance, to wear a mask if needed. But that's not until next Friday. I'll now hand back to the Minister.
Thank you, Mark Roach, Deputy Commissioner, Queensland Fire and Emergency Services. This is a serious event. It is a life-threatening event, and we've seen that from the outcomes of the last couple of days. And what's disappointing to me is that we are actually seeing the footage of people driving into floodwaters, actually making a decision to drive into floodwaters. That puts their lives at risk, puts the passengers at risk, and also all the emergency services that are required to go out there and conduct those rescues. We found a number of rescues this morning where people were clinging onto trees. I don't know the details specifically about how that occurred, but people should not be on the roads in events like this. We knew this event was coming. We've been warning about it for the last couple of days, and it is here at the moment. So my message to everyone is, if it is flooded, forget it. Not only a message to the drivers, but also to the passengers. If you feel unsafe, make sure that that driver turns around, has a plan B and takes an alternate route. The other thing that I think you need to be very clear about is that you should not be on the roads or driving on the roads in these conditions, especially when we're talking about a midweek. When children need to be dropped off and picked up from school, we need to be very, very wary about the roads. There's no surprises out there. We know the rains are coming, we know the rains are here, and we know that the roads will be flooded. Thank you.
Good morning. So just to add to what the Minister and Deputy Commissioner Roach have said, this event is still going, so we're expecting more intense rain continuing through today and into tomorrow, and we are currently in response. So that means we have operations running continually at the moment. So that messaging around, if it's flooded, forget it, and staying off the roads will remain in play for at least through today and into tomorrow. So please take heed of it. As the Deputy Commissioner said, the vast majority of people who end up in trouble are because they make the bad choice at the time where they could make a better choice. And what I mean by that is when confronted by water, they choose to go through it, and they put themselves and those that have to rescue them at risk. So on top of the significant rain we've already seen, we have soaked waterways and ground. So that means we're going to see lots of runoff. So can expect more flash flooding, and we are planning to deal with riverine flooding, particularly in the Mary River. We are expecting inundation of some properties in the Gympie area, and we're watching very closely to see what will happen in Maryborough, and we'll keep you updated on that as it unfolds, I should say. Our local disaster management groups are all stood up. We are well prepared for this. As I just alluded to, some of the communities have already been through this, so this is a difficult time for those. Emergency alerts have already been issued for Noosa, Gympie and North Burnett areas, and similarly we put out emergency warnings for the Sunshine Coast, Somerset, Toowoomba and the Lockyer Valley, and they remain in place. So please stay connected to what's happening in your community and the messaging that's going out. We have multiple road closures. So if you do essentially have to be out there, make sure you check before you travel whether it is safe to do so. Currently the township of Gomerri is inaccessible. We expect more of this to happen as the day unfolds. If you need assistance from SES, please call 132 500. But of course, if it's life-threatening, ring 000. We will respond where we can. So to reinforce those messages, don't be on the roads unless you need to be. Try to avoid any hazardous areas. Make sure that we're not out there on foot either. The Minister mentioned we want to make sure that all our children are safe and those people that are out and about aren't taking unnecessary risks as well. Please allow additional time for your travel when you need to do that because of the conditions. And I'm just going to finish off by saying something that you're going to hear repeatedly as we have this sort of weather. If it's flooded, forget it. Thank you.
Steve, sorry. You've touched on it already, but what are the worst hit areas at the moment and what areas are you most concerned
Look, this extends pretty well from Gympie to Jimboomba areas where we're seeing the really intense rain. Up to 180 millimetres is the prediction, but what we're seeing is very intense falls in particular areas. And the one thing people need to recognise with this, whilst we can get these predictions from BOM, which are great, until the rain falls, until we see where it falls and when it falls and how quickly it falls, we don't know what's actually going to happen. So these flash floods can happen really, really rapidly. People need to recognise this is a really hazardous environment in that whole area for now, and probably a good time to stay out of it and stay home.
And when are you expecting the worst of the weather to be?
Look, we expect from the BOM briefing this morning that it will begin to ease into tomorrow. You know, but it's look, we're still in a La Nina event, so we're expecting elevated rainfall right through the coming months. So we expect this particular event to ease in the coming days, but people need to stay connected.
And in terms of extra resources, have you got extra, like Swiftwater Rescue going out? Or
Yeah, I'll let Mark talk to that, obviously, for Swiftwater Rescue, but certainly I've engaged with all of our district disaster coordinators and our road policing command this morning. We're pushing additional resources into those areas that need police on the road, and we're increasing our messaging to make sure that people realise the risk they're confronted with.
Are you aware of anyone who's unaccounted for this morning?
At this stage we have no unaccounted persons. There is a search and rescue on in Townsville, but that's unrelated to this event. Thank you.
Other questions? I've got a quick COVID question, just about the impact. Do you have any idea about what impact it may have with the easing of the masks?
Well, we're confident that we can do this without increasing significantly the risk because of what we're seeing with a decline in the hospitalisation numbers and the number of cases that we are reporting each day in the community. This has always been about making sure that we don't overwhelm our hospitals, and our hospitals are doing very well with managing our COVID patients now. And as I say, we've gone from a number of wards in many of our hospitals down to, in most cases, one ward, which is fantastic news, if not all of them down to one ward. So we think this is, I think the Chief Health Officer said it best the other day when he said, well, if not, when? So now is the time to lift the mask, but we all need to be conscious that if there is a spike, and particularly going into winter, that we could bring the mask back, and also respecting the right for any individual who feels uncomfortable and wants to wear a mask, that they should do so.
Dr. Drive mentioned where we were a month ago. Where do you see us in a month's time, or are you sort of cautious about winter?
I don't know if I'd predict, a month's a long time in COVID, but look, I really, I hope that we have, even less cases in our hospitals, but we have to assume we're going to have cases in our hospitals going forward for COVID. That's what we've planned for. So we're not going to get back to, where we were in mid-November, where we only had 4 active cases across the state. We're not ever getting back there. This is now part of, our lives, and people will contract COVID, and we will manage those unwell patients in our hospitals that need that sort of care. So, but as we head into winter, we're not sure. I suspect that we will be very shortly, when the flu vaccine arrives, sometime in March, start talking about people going out and getting their flu shot. And that will be a really important message, and I welcome the advice that you can get your flu shot and your COVID vaccine at the same time. They're not in one injection, it means two jabs, but you can get them at the same time. They don't have to be days or weeks apart. And that's going to be really important as we go through winter, because not everyone has their booster yet. And as we know, not all children have had their vaccinations yet either.
I have a question for Mark, if that's
Sure.
okay. Do you know where emergency evacuation centres have been set up throughout the southeast?
There are a number of emergency evacuation centres or places that are available for people. The best bet is to actually go on the local websites and identify where they are, because they may open and close as is needed, and it will depend on the location as to where they are. And local governments, through the local disaster management group, will communicate that information very quickly.
And with SES receiving at least 120 calls for help in the past 24 hours, do emergency services have the resources to respond to every call for help?
Yeah, at the moment we've got additional crews that have been brought on board. SES crews, now we're well and truly over that 120, because this is a moving feast, and it's all over southeastern Queensland. So we actually did a hook-up this morning with all of those regions to identify what resources they had. Some of it had been moved from far north and north down to support, but we also have swiftwater, floodwater rescue, fire and rescue crews that have been pre-deployed in some of those locations that we believe the risk will be increased. So we've got the staffing, the volunteers and the staff available to assist as we need.
Thanks, everyone. Thanks, Mikey.